Hey guys, Dr. McClimon back with McClimon Chiropractic, and today we're going to talk about TMJ or temporomandibular jaw syndrome, which is where you basically have pain in your jaw. Okay, if any of you experienced this before, it's really uncomfortable, but it is a common. About 5 to 12% of the population will experience this at some point, and so chiropractically, there is something that we can do to help that. Now, typically they might give you a muscle relaxer or a painkiller to help reduce the inflammation and the pain. But chiropractic, again, looks at things, looks at the structure, because the structure typically dictates the function, okay? So guess what this is? This is called a textbook. For you out there that never have seen one of these before, this is called a textbook. I'm using it for a demonstration of the picture, okay? So here you can see the actual TMJ joint, which is right here, right where your jaw meets your skull there. It's called a hinge joint, okay? You can see it right here, all right, if you're not familiar. So it basically, the jaw comes in, meets like this, and then as you open and close, it shifts like this. Now inside that joint, there's a fibrocartilaginous disc that is a cushion in there, and as you open and close, that disc slides forward and backwards. Now sometimes the jaw joint itself can actually shift, and when it shifts, it can alter that disc material in between that joint. That's where you get that clicking, that popping, and sometimes that pain. And so chiropractic can do an evaluation through exam, through x-rays, to see if the alignment of the TMJ is in a good position. If it's not in a good position, we can actually make specific adjustments to the TMJ to improve that alignment. I will say this, the TMJ is the most proprioceptive joint in the body, so it's very, very sensitive, and we don't like to work on that until we have made sure that the cervical spine is cleared out. If there is subluxation or misalignment in the neck, that can also contribute to TMJ, and many times we find that clearing out the cervical spine, making sure there's no misalignment there first, actually clears out the TMJ. So we always start there. If that doesn't clear it out, then we'll actually move to the TMJ. We can make adjustments to that to realign that and improve the function and the structure there. So guys, if you're struggling with TMJ, traditional approaches haven't helped you, you haven't tried chiropractic, it really is something that helps a ton of patients, and it could help you. God bless.